Hi folks, Dr. Ed Beyer of Beyer Natural Health Solutions here in Tinley Park, Illinois. I've been practicing functional medicine for 33 years, and what I see, one of the questions that I get a lot, or what I see a lot, is younger females. When I say younger, I'm 61, so females in their 20s, 30s, and even 20s and late 30s, up to late 30s, they're on birth control pills or any type of form of contraception, and they're not on it to prevent pregnancy. They're on it, the majority that I see, is because they got female hormone problems, PMS, heavy periods, light periods, missing periods, migraine headaches, bloating, pelvic pain, fibrocystic breast, endometriosis, all these different things that I see, and they go on the pill, and it may help them temporarily, but let me tell you, what the pill does, what birth control does, is it stops ovulation. And what a lot of my female patients that come to see me don't realize, and a lot of you that are maybe watching this, is a female is meant to ovulate, not just to get pregnant. There's over 130 different chemical reactions in a female body that are dependent upon ovulation. When you go on any type of contraception, you are preventing all that from happening. And if it sounds like I get a little upset about it, it's because I am. Not at you, but you go to your gynecologist, OBGYN, and any type of female hormone problem, they put you on these medications. Well, I want to educate you a little bit today on what they are doing. So one of the things that any type of birth control causes, when you don't ovulate, then you don't produce a lot of progesterone in the second half of your cycle, and a female becomes estrogen dominant. Now, the moment you go on the pill, your chances, the average female, 1 out of 8 females is going to get breast cancer. When you go on the pill, that number goes down to 1 out of 5. So it greatly increases your chance for cancer because you become estrogen dominant when you go on the pill. Higher estrogen, lower progesterone. And that, most breast cancers are estrogen fed, and estrogen causes growth, fibroids and cysts and things like that. Then progesterone goes low. Let me tell you, a lot of your symptoms that you're experiencing are due to low progesterone. Anxiety. Progesterone is extremely calming to the brain, so anxiety is a very common symptom with low progesterone. Your cycle becomes irregular. You start to lose hair. The hair follicles depend upon proper amounts of progesterone. Cramping, acne, because you're making more testosterone, and that causes polycystic ovarian syndrome. Low sex drive, excessive bleeding, mood swings, and depression. These are all the symptoms of low progesterone. I don't even know if I have bone loss in there, but that's another one. And so the other reason why you are going on the pill in the first place, one of the reasons why you may have PMS and all these different female problems, the reasons why your OBGYN put you on the pill, is you have weak adrenal glands. When you are premenopausal, when you're a menstruating female, 35% of your reproductive hormones come from the adrenal glands, not your ovaries. A third of them come from your adrenal glands, which are our stress glands. So one of the reasons why you're suffering with hormone problems is because your adrenal glands are fatigued, because you're either stressed out, either psychologically or physiologically. We'll talk about that. 50% of the reproductive hormones when females are in menopause come from the adrenal glands. So adrenal health is paramount to hormone regularity. Now, what would stress your adrenals? Common ones are abnormal blood sugar, too high, or I see a lot of females where their blood sugar is too low for various dietary reasons. Poor diet and anemia will drive your adrenal glands, stress your adrenal glands. Lack of sleep, poor relationships, any type of stressor. We approach those and address those in functional medicine, and so we can get people's females' hormones balanced. Now, the symptoms of estrogen excess, which occurs when you go on any form of contraception, is weight gain, right? Who wants that? Fatigue, low libido, heavy menstruation, because estrogen is growth. It's all about growth. It produces things, the breasts and vaginal canal and ovaries, all that developed in puberty from higher amounts of estrogen. And so we see heavy menstruation because the endometrium thickens too much. Breast swelling, tenderness, cystic ovaries, uterine fibroids, craving for sweets, water retention, fibrocystic breast, all these extra growth that occurs, and we already talked about the increase in breast cancer when you go on contraception. Now, the other reason why many of you are suffering from hormone imbalances and think you need to take birth control to get them under control is because you're inflamed. Systemic inflammation does two things to your hormones. It shuts down the hypothalamus and pituitary gland, which are the part of the brain that controls your adrenals and your ovaries. That is like the air traffic control tower of your hormones. That brain endocrine connection you lose. So high inflammation makes that area of the brain not work very well. And a high inflammation doesn't allow your hormones to attach to the receptor sites on your cells. If they don't attach, you can have good amounts of hormones, but if they don't attach to those receptor sites, they don't work. So that's another reason why you're suffering this. So we look at the underlying causes of systemic inflammation. All this stuff traditional medicine doesn't look at, but we, from a functional medicine perspective, we do. So food sensitivities. Listen, the food we eat today is not the same food we ate 20, 30, 40 years ago. It's been genetically modified. There's all kinds of pesticides and chemicals on our food, and that causes our immune system to react to it. You're not getting the right amounts of essential fatty acids. You're eating bad oils, trans fats and vegetable oils, which create inflammation. Those are bad for you. And then you're not getting the good oils like fish and avocado and things like that are really good for us. Leaky gut syndrome, where the gut barrier breaks down, that'll create a flood of inflammation in the body. Bad gut microbiome, low thyroid will do it, and there's so many reasons why your thyroid could be off that your doctor doesn't look for. Autoimmune disease, where the immune system's attacking tissue in your body, creating systemic inflammation and not allowing your hormones to work, to be produced, nor attached to the cells properly. Hidden infections, especially in the gut. Poor diet, like sugars and alcohol and caffeine that cause inflammation. Poor digestive function. Any type of digestive function is going to create whole body and brain inflammation, and poor liver. So these are the reasons why your hormones go out of balance in the first place. You go to your doctor and they're going to put you on birth control, which causes a whole downstream negative effect. So I feel responsible to educate people out there, females out there, about these things. And in all cases, we can get them off the pill and not have the symptoms that they had prior to going on the pill. I'm Dr. Ed Beyer. If you enjoyed this information, please like my YouTube page, share and subscribe to someone that you may know that's suffering from this, or subscribe. Hope to see you soon.